It is time for another Y107 MU Healthcare Ask the Expert. And we've all had that cold, that rash, that whatever, and you just don't feel great. And you're like, do I really need to go to urgent care? Can't I just call my doctor? Well, they need to see some symptoms sometimes. So we've got our expert is emergency medicine physician George Kobaroff from MU Healthcare with us to talk about on-demand telehealth and how it works. Let's start with this. Who should consider using on-demand telehealth?
So telehealth is a great option for people who have busy lifestyles and don't have time to come and see the doctor in person and or can't get an appointment in to see their primary care doctor. Generally, it's useful for kind of lower concerning type of illnesses. So if you have a minor concern or just need some advice on how to feel better, that type of thing, then urgent care virtually or on demand is a great option for you.
I mean, is it similar to urgent care, just virtual?
So the similarity with on-demand care and actually going in to the brick and mortar urgent care is that you'll be able to speak with and see virtually a provider, whether that be a physician or a mid-level provider. And we can get your story and we can get a lot of your assessment just over the virtual connection in terms of how you appear and maybe some things such as a rash, those kind of things we're actually able to evaluate the same we would be able to if you actually showed up in person.
It seems like this is a situation where you're like, well, I need to have this looked at or I want to talk to somebody about it, but I gotta drive, I gotta do all this. It's the best of both worlds, really.
No, I think that's spot on as to what we can do. So I think we can help kind of give you some advice, number one, on if you do need to be seen. So if you have a concern that you don't think is necessarily a big deal, but just aren't sure, we can help point you in the right direction as to whether you're, thinking correctly about that. But there's a lot of things too that we can kind of just take care of virtually that prevent you from having to go in and spending the extra time and effort commuting into a urgent care location.
Yeah, when you already don't feel good, the last thing you want to do is get out and drive. Especially if the weather gets bad or whatever, you can start at least on-demand telehealth from home. Download the app, find out all the details and more. Go to muhealth.org/on-demand. You can actually see an MU Healthcare provider from the comfort of your own home in your PJs without having to go to the doctor or an appointment.
No, that's exactly right. So as long as you have the technology to be able to do it. So, you'll need a tablet or a phone with a video and an audio connection of some sort. Then you can connect with us through the app and be able to speak with us directly. And then we can address generally, minor complaints, things like fever or cold type symptoms. You're worried about pink eye. Rash is a great one for us to be able to do because visually we can actually see that. Sore throat, those types of things. Now, we can't handle everything virtually that way. We may need to send you in for testing of some sort. So if you're worried about a urinary tract infection, your story may be compelling, but we still want to make sure we're practicing kind of the standard of care in medicine, and we may need to send you in to drop off a urine sample or get your throat swab to check for strep, that type of thing.
Now, some people might think it's too complicated to try this. Is it hard to schedule an on-demand telehealth visit? How does that work?
So it's really very easy. So I think if most people probably have some familiarity with getting on a kind of face-to-face app like FaceTime on Apple, that type of thing. It's almost that easy. So you'll go on to the platform, you'll get to the MU On-Demand Healthcare website, and then you'll just register some information that they're going to need, so like your name, that type of thing, and then you'll get registered, and you'll be able to connect directly with a provider at that time.
So when should someone consider this on-demand telehealth versus going to the urgent care or to the ER?
So I think one of the good indications to do that is when you just think you probably have something more minor. If you feel like you have something serious, so if your concern is, I wonder if this chest pain is because I'm having a heart attack, or I've got this terrible headache, I'm worried, could this be a stroke or something along those lines? That's probably beyond the capacity of what we can do for you virtually. However, if you're just not feeling well, you just want some advice, you're like, gosh, I've had these symptoms, what can I do to make it better? Then the urgent care on-demand platform is exactly what you need.
And what about the availability, the hours, and that sort of thing?
So the on-demand platform is open the same hours that we are at the brick-and-mortar locations that we have. So it's 8 a.m. till 7:30 p.m. to be able to service you on the on-demand platform. And what you'll do is you'll just go to MU Healthcare on demand. You can Google that. It'll take you to the website and go ahead and get registered, and we'll be able to take care of you that way.
It really is amazing, especially if you are a single parent or you're at home with a couple of kids and maybe they're sick too and you're running around. You don't want to have to pack them up to get to the doc. You can start at least with on-demand telehealth. Again, download the app. Go to muhealth.org/on-demand for more details. Dr. Koberoff, thank you so much.